Hi there, I'm Brian Williams, aka Brian Weems Williams, and what I do is Medicare health insurance and nothing but. I have over 2,000 clients on Medicare, and the first thing people want to know is how's it all work? So I'm going to attempt to explain that in about 5 minutes. All right, just a general understanding of Medicare. When I talk about Medicare, I explain it as government health insurance that's not free. You have to pay for it. Currently, about $145 a month. And from that point, there's basically two approaches. You can either supplement Medicare or you can do what's called Medicare Advantage. And when I see people in person, normally I say, don't worry about it. I got notes that I'm going to leave with you that kind of explains what we talked about. All right. And I can email this or fax it to you or send it to you in the mail these days. So that's how we'll get it done. But Medicare begins with what we call original Medicare, your Part A and Part B. What do those parts do? Part A generally is free. You worked for that. That's for the hospital. If you're hospitalized, there's a deductible to be there. It's roughly $1,400, whether you're there a day, a week, a month. It covers you up to 60 days. Now, the trick is it's not an annual deductible. Oh, I don't mind going back in the hospital. Already met my deductible for the year. No, when they let you out, they start keeping track. If you're back in within 60 days of discharge, that's okay. It's still the same benefit period and no more money out of your pocket. But if it's more than 60 days, you go back in the hospital again, yeah, it's a new benefit period, another $1,400 out of your pocket. Now, hardly anybody pays it because they either have a supplement, which pays it every time you're there, or these advantage plans. A lot of times they chop it into pieces, and you might pay $200 a day in the hospital up to 7 days. But if you're only there 3 days, your bill's probably $600. We'll talk about that more in just a little bit. The other key thing Part A does is skilled nursing or rehab. If you have a 3-day hospital stay, Medicare is willing to pay for 20 days of inpatient rehab at a skilled nursing facility. So 20 days at no cost. Average stay, is, I'm told, is less than 2 weeks. But if you're there longer, there's a cost per day to be there. Currently, it is $176 a day, day 21 through 100. Now, a supplement to Medicare would pay those extra days. Advantage plans, you would pay that extra $176 a day. So that's Part A, those two key things, hospital stays and rehab stays. Part B is pretty much everything else. It's all your outpatient services. Anything you think of outside of actually being in the hospital is a Part B cost. So that's any doctor you'd see, your lab tests, your diagnostic procedures, your x-rays, MRIs, CAT scans. Outpatient surgeries, often even done at the hospital, are still under Part B. As soon as they're done doing that procedure, they're going to let you go home. Medical equipment, the walkers, the wheelchairs, the canes. It is urgent care visits and ER visits. Hey, you're at the hospital, but they haven't admitted you yet, so you're still under Part B. So again, Part B is the part you're paying for, currently $144.60 a month. So Part B has its own deductible, which is annual. It's once per year. This year it's $198. You would pay that first. And then this is the part of Medicare that's 80-20. Medicare would then pay 80% of your bills. You pay 20%, but the 20% you pay is to infinity. There's no cap on that. So once you have the A and the B, like I say, there's these two paths to pick from. Let's talk about a supplement first. I'm going to grab this. Eventually you'll get one of these and get one every year. I always joke about the happy smiling faces on the cover of this book. They're having a blast. Come join the fun on Medicare, right? Okay, on page 70, we take a look at something called Medicare Supplement Insurance, known as Medigap. There's 10 plans, but two get most of the attention right now. That's a Plan G and a Plan N. Plan G, the only out-of-pocket expense you have for the whole year is the Part B deductible of $198. You pay that yourself, and then for the rest of the year, pretty much no bills. And a Plan N is another good option. After that deductible, you'd still have a copay of about $20 to see a doctor and $50 to go to the ER, but you pay less in premiums. Now, what will you pay as far as premiums? Well, there's 50 different companies who want to sell this to you. Males are more expensive than females, and it depends where you live. Now, I serve central Pennsylvania, Lancaster, Lebanon, and Berks counties. We're pretty lower cost than many areas of the whole country. Obviously, your major metropolitan areas, your Philadelphias, your Pittsburghs, more expensive. Okay. Roughly in costs, it's all over the place, but a male Plan G could be $120 on up. Females are less expensive by $10 to $15. And on both males and females, Plan Ns are typically $20 less, and monthly premiums on the equivalent Plan G. So more about that when we talk on a one-to-one basis, be it on the phone or Skype or face-to-face, whatever it is. All right. Now, no supplement has prescription coverage. You would need a Part D, D for drugs. So back to your Medicare and You book, or go to Medicare.gov. That's the best place to go. But it does reference in here some of the 31 choices you have for a Medicare prescription drug plan in Pennsylvania this year. Every drug plan has a monthly premium, anywhere from $13 a month on up. Some plans over $100. National average is probably in the low 30s. They all work the same way. They categorize the drugs you take into 5 different tiers for what they are. 2 tiers for generics, 3 tiers for brands. The more expensive the drug, the higher the tier they put it in, and the more you're going to pay for it once you get it. The tier 1s are preferred generics. They might be free, couple of bucks, not expensive. Tier 2 generics also, anywhere from, say, $5 to $20 a month. Brand name drugs. Oftentimes there's a deductible, an annual deductible shared amongst these higher tiers before you get a reasonable price for your brand name drug that costs hundreds or thousands of dollars. So once you meet that deductible, a tier 3 might be a $45 copay. Tier 4 might be $100 or a percentage of what it costs. Tier 5 is the really expensive drugs. Those are typically in the thousands of dollars. You have to pay a percentage of what they cost. Prescription drug coverage, big complaint on Medicare. Big complaint with any insurance, but Medicare has something called the donut hole, which I would say for a one-on-one explanation with you. So this is the first approach to Medicare. On this approach, Medicare itself is primary. You have a supplement to pay what Medicare didn't pay, and then a prescription plan just for your prescriptions. All right, the other approach to Medicare is Part C. I don't know if that's a C or not. Medicare Advantage. This is a lot of the stuff you get in the mail as you approach age 65. There is over 50 plans for this in central Pennsylvania. Lancaster County has over 60. And we kind of consider this Medicare replacement. So Medicare is not processing your claims. You're still paying that $145 a month to be on Medicare, but now your costs are determined by your insurance companies. And I can't mention specific names because I don't have the authority to do that. But needless to say, there are many, many choices in central Pennsylvania. A lot of the plans look alike. Most of these plans have no deductible at all. What they have is co-pays for services, most of which are very reasonable and certainly predictable. It's kind of like a Chinese menu. Here's what everything costs. All right. So it's, might be $5 or $10 to see your family doctor. Seeing a specialist might be a $40 copay. Lab work might be anywhere from free to $30. X-rays fixed $50. MRIs, CAT scans, it's a more expensive procedure. Might be, $275. So everything has a cost. Even the hospital has a cost, and it's not crazy expensive to be in the hospital. It's certainly not $1,400. Like I say, the Advantage plans kind of chop it into pieces. You might pay a cost per day, or certainly a lower cost if it's per admittance or per stay. The 5 tiers for prescriptions are baked into these plans. And the reason why a lot of people do Medicare Advantage as opposed to a supplement to Medicare is, I don't know, have you seen Joe Namath on television? It sounds really good, right? A lot of plans have no monthly premium. Okay, you still have to pay to be on Medicare, but you might have no premium or a very low premium and very reasonable costs for services. What's the catch? Why wouldn't everybody do this? The catch, if you want to call it that, with Medicare Advantage is networks. On these plans, you have to make sure your doctors and hospitals participate with your plan, though you can go out of network if your plan's PPO, which a lot of people do. You just might have higher costs. And the other catch on an Advantage plan is both good and bad. Medicare's never had any kind of out-of-pocket maximum under A and B. Advantage plans do. Now, a lot of these Advantage plans have an out-of-pocket maximum for hospital and medical services only. Prescriptions don't count. That has the donut hole. Of $6,700 a year in network and $10,000 combined in and out of network overall. Now, it's not real easy to get to that number. Generally speaking, the number one way someone will get to a number that high is from cancer treatments like a chemotherapy. That's a different kind of drug. That's actually a medical cost. You'd pay 20% of that chemo treatment, and it's certainly going to be thousands of dollars, and 20%. You're on your way to your $6,700. Um, so there's these two paths. All right, you got to pay to be on Medicare. You can pay extra for a supplement so that the insurance company is going to pay those bills. Or no, many people don't pay any extra above and beyond what Part B costs, and they have their Advantage plan. Now, there are rules about when you can make changes to your plans, and that's something that we would discuss on a one-to-one basis. So hopefully that gets you started with kind of understanding how Medicare works, and we can talk more about this, like I say, on a one-to-one basis. And for the time being, it's probably over the telephone. 717-468-0130. I'm Brian Weems Williams. When this video is over, it's probably going to take you to YouTube. I'm not endorsing those other things. It's just the way YouTube works. All right. So hope to see you soon. Thanks so much.